Okay, so this other stuff gets into more complicated, but let's see what I have. So that's basically what we're going to do on the knee, because that's the end of the notes, right? So what I'm going to do is I'm going to show you some video clips of some of these orthopedic tests. You can see what normal knees are supposed to do and what knees aren't supposed to do. Okay. So we want to cut the legs. This is going to be a normal test. You're going to do anterior drawer and posterior drawer. So these are movements where you're going back and forth. The other one too. So there's a little bit of movement, but that's not so bad. Okay, so where from the background there, where does it look like they're at? Probably just in somebody's office, right? Just regular clinic. Where are these people at?
Yeah, surgery.
Okay.
I don't want to watch this one.
Okay, so don't, just close your eyes. Some people might want to see it, some people might not. So if you don't want to watch it, you don't have to. You have to watch it like this. Okay. Luckily mine wasn't that bad. Let's skip to the next one. Okay, so where are these guys at now? So do you think this is going to look good? Yeah, that's another modified test. If you do the drawer test like this, where the knees flex more, then this one is where the knees not flexed very much, and then you're still doing an anterior drawer test. But this one's called lateral. Okay. So now this one's the posterior drawer. So the tibia is not coming too far forward, but it's dipping down a lot. And then these are the ones where you're adding that rotation. Okay, so you rotate this way, test in the anterolateral, anteromedial, posterolateral, anterolateral, posteromedial. Okay, so now we'll talk about the foot and the ankle and the lower leg. Basically, we started here, we worked our way down this way, went down here, we just did the knee, now we're heading down the bottom of the lower extremity. Okay, so this is what happens when you get your muscles all tied in the knot. Right? So the foot and the lower extremity is going to propel the body. Okay? So, and problems with your feet can affect the whole body. If your feet don't feel good, a lot of times your whole body is not going to feel so good. Okay? So a large percentage, about 80% of the people have had at least some type of problem with their feet at one point in time. And obviously there's podiatrists, and that's pretty much what they spend all their time dealing with is the foot and ankle. But also pain, as you mentioned before, pain that's going down can come from the lower back. You can have nerve root problems or things that can be coming from the lower back that can affect the foot, or there can be local problems in the actual foot itself. So again, we'll talk about the inert tissue. So you have bones. Okay, so coming down from the lower leg, you have the tib fib, right? And then we talked about the proximal tibiofibular joint, and then you also have the distal tibiofibular joint. Okay? And then this is what's called the ankle mortise joint, which is between the tibia. The tibia takes up the primary part of the ankle joint, just like it does at the knee, and the fibula is only secondary, but you can see it's on the lateral part here. So this is the ankle mortise. If you look at it here, here's the talus, and then this is the tibia and the fibula here. Okay. And then you can see from the lateral view how the curved portion of the tibia like this. Okay. So that's what's called the ankle mortise joint. So it's the tibia and the fibula coming down like this, and then the talus goes up into here like this. Okay. And if you look at the talus, the posterior portion of it is narrower than the anterior portion. Okay. So what that means is when the ankle is forced into dorsiflexion like that, you can't have a force that's going to spread apart the tibia and the fibula. Okay? You ever heard of high ankle sprains? Okay? That's where you have a sprain right here of the ligament between the tibia and the fibula, and it happens when the foot's forced into this direction like that. We'll talk more about ankle sprains in a little bit. But also when the foot's in this position like that, like wearing high heels, there's going to be less stability of the joint because the posterior part of the joint surface is narrower than the anterior part.
Thank you.
So this is kind of a loose thing where you can see all the different bones of the feet. You have the calcaneus and the talus, obviously going to be the larger bones. Then you have the navicular. You can see this one's shaped like a little boat. That's how it gets its name, right? And then you have these first three cuneiform, or the three cuneiforms. Then you have the cuboid here. Then what are these? Yeah, they made these out of those little metal pipes. You could do like a little wind chime, right? Okay, so these are metatarsals. And then these are the phalanges here. Okay. And then you have this calcaneal tuberosity, which is right here, and then that's where the plantar fascia attaches, right? So plantar fasciitis, again, as we mentioned, it's going to happen right here. And then there, that's basically going to show the different bones of the feet. And then you have the arches of the feet. Okay, there's three arches of the feet. And actually here, this shows the plantar fascia too here, and then there you can see the attachment of the plantar fascia. Okay? So we have three arches of the feet. Two are longitudinal and one is transverse. Okay? So we'll talk about the medial longitudinal arch, the lateral longitudinal arch, and then the transverse arch. Okay? So there's a difference between high arches and low arches and pronation versus supination. I mean, you can still have pronation and have high arches in your feet. You can have flat feet and not be pronated. So they're two slightly different things. So here's the medial longitudinal arch. So it's going to be the the calcaneus, the talus, then the navicular, then the first cuneiform here, and then the first metatarsal. So that's the actual bones that form the arch right there. Medial longitudinal arch. Okay, so then if we come to the lateral side, what's this one going to be? Calcaneus, then what? Cuboid, and then fifth metatarsal. So there's less bones involved on the lateral arch. So calcaneus, cuboid, and then the fifth metatarsal, and actually the fourth metatarsal is also considered part of that lateral arch. Okay, so the lateral arch is going to be flatter, whereas the medial arch is going to be higher. So if you look at footprints in the sand, right, you see the lateral side of the foot presses in, and then the medial side is where it has that arch. And then you have the transverse arch, which is looking this way, where it's basically like this, okay, where it arches across the metatarsals. So it's an arch this way. Okay? So you can see here. So here's where the arch is like this, and then this is where it's flattened out.